My name is Cyrus Hodes. I'm the chair of the AI initiative at the Future Society, and I'm very excited to share this session today to talk about digital public good. So the title of the session is Leveraging Data and AI to Achieve the Sustainable Development Goals while Moving Towards Global Data Access Framework. So I know this can be a bit of a mouthful, but you will understand where we're getting to. Let me remind you quickly what recommendation 1B of the UN Secretary General High-Level Panel on Digital Cooperation report and roadmap is. Secretary General mentioned, we recommend that a broad multi-stakeholder alliance involving the UN creates a platform for sharing digital public goods, engaging talent and pooling data sets in a manner that respects privacy in areas related to attaining the SDGs. So what are the ways in which we can access quality data that can help getting to these sustainable development goals? We have a diverse panel of experts to bring different relevant viewpoints on the use of data for resilience to target non-communicable disease, as well as infectious disease. So we also focus a bit on what could be a more reliable and privacy protective way to access data, which is the Global Data Access Framework, which is an evolution of the Global Data Common exercise that has started at the World Common Summit in Dubai, brought to the AI for Good and to the UN General Assembly. This is a collective exercise led by UN Global Pulse, McKinsey, and the AI Initiative at the Future Society, together with 100 stakeholders or more coming from technology firms, academic institutions, NGOs, and UN agencies. Now, we're gonna have Robert starting the panel if Robert has managed to join us. Otherwise, we can shift to another panelist. Robert, are you there? Fantastic. So I see you there, Robert. I give you the floor. So Robert is director of UN Global Pulse, and he's going to focus his speech on the Global Data Access Framework. Robert, the floor is yours.
Very good. Thank you, Cyrus. So thanks to all of you for joining us today. I'm really excited to speak with you. I'm going to kick things off here with a brief overview of the Global Data Access Framework and why I believe it has a critical role to play in the Sustainable Development Goals. The data landscape today is broken in so many ways. The fact that you are here today for this event means I don't need to enumerate these ways to you or to tell you that the situation is only getting worse. Let me instead simply assert that we need to get to the sort of, if we want to get to the sort of future that we can look forward to versus the more dystopian alternatives where 95% of all the data and all the financial wealth in the world is in the hands of, say, 10 people. This requires an entirely new data architecture for the world. The Global Data Access Framework is based upon a vision of the future in which the full potential of the world's growing ocean of data, combined with the power of artificial intelligence, automation, and other emerging technologies, is unleashed to serve the public good. At its core is an intention to develop a common reference architecture for a set of universal services that will enable a seamless flow of data and data-driven insights. Imagine a world in which anyone with data, whether an individual, an organization, or for that matter, an autonomous software agent, has a simple way to make the existence of that data, together with a detailed description of it, and whatever technical, legal, and financial processes are required to access it, discoverable by anyone, anywhere. In a sense, this initiative has its deepest roots in the open data movement, the open source software movement, and the ICT for D movement. But at the same time, it acknowledges that much of the digital data that exists today is big data, which comes with a host of privacy-related issues that prevent its being openly shared. It anticipates leveraging advances in privacy protection, computation, and machine learning to safely train and deploy AI models using data that in itself is far too sensitive to share with anyone. It also recognizes that an urgent need to accelerate data-driven innovation for the SDGs and to ensure sustainable and scalable access to real-time information, predictive insights, and smart services. It requires compelling incentives for private sector, for the private sector. I mean, it's something we really have to understand. With that, let me dive into what we're trying to do here. Pardon me 1 second, if you will. My apologies, the realities of living with children in the house. So what I wanted to do is essentially take you through some of kind of how we got here in terms of our thinking, us and our partners. You know, out there are a number of existing initiatives that have been created over the past few years to increase the amount of data available to achieve the SDGs. And these range from data sharing platforms such as the UN's Big Data Platform, CGIAR's platform for big data, work that MasterCard has been doing to open up access to their data in an anonymized form for researchers. There are insight sharing platforms that don't directly involve sharing data, but allow insights from data to be shared at scale for various purposes. The World Bank, for example, has a platform that involves enabling access to insights and aggregated data from lots of different commercial organizations. UNICEF has their Magic Box platform and so forth. You know, Facebook is looking at, you know, has an aggregated data platform for geospatial insights and so forth. And finally, there are a number of initiatives that look at various protocols and governance tools to enable more of these types of data collaboratives. So we've seen a landscape that over time has been maturing with a number of these different types of efforts. But that said, we continue to face challenges to data sharing at scale. Right? Despite a number of collaborative initiatives, we still are essentially, I wouldn't say quite stalling, but we haven't seen the progress that we need in moving toward this vision that we all share. Right? And there are a number of reasons for this. I mean, one is simply the lack of strong evidence base to support investment. And by this, I mean that you know, we have a kind of chicken and egg dynamic in which, you know, you're not going to see really large scale sharing and you're not going to see really large scale investment in data-driven solutions until there is compelling evidence that, you know, if you put the right regulatory mechanisms in place and make the right investment, you can change the outcomes at scale for people. And I think this is one of the main challenges that we've seen. Lack of shared vision and cohesive implementation mechanisms, a lack of capacity to adapt and integrate insights, right? This is not a straightforward proposition for many organizations. There's not a common approach to consumer privacy, data protection, and risk mitigation out there. There's no playbook for this from a regulatory and governance standpoint. And technological advancements continue to outstrip regulatory frameworks. So back in 2018, as conversations were getting underway around the AI Commons, that led to a discussion saying, hey, look, if we're going to have an AI Commons to train that AI and to power that AI, we're going to need a data commons. And over the course of last year, there was a series of 3 workshops held, first at the World Government Summit, then at the AI for Good Summit, and finally during UN General Assembly, that was specifically looking at, you know, what would it take to move toward a data commons? And a lot of progress was made in that process, along with a recognition on the part of the majority of the participants that it wasn't actually just a data commons that we needed, because a data commons by definition would be all open data. It would be all accessible to everyone. And what we realized is there's a lot of data out there that can't simply be opened up to the world for free because, for example, you know, it's big data that comes, you know, integrated with people's personal information and it's too sensitive to share, right? So how do we do that? what is it? What are we actually looking at? Well, we said maybe it's not a data commons. We need a common framework that can enable access on a very large scale. And you know, the vision for the global data access framework is basically to set in motion a global movement that will significantly scale up responsible access to data, empowering an unprecedented number of public, private sector, and social sector actors to use data for good, right? And part of what we're trying to do is to enable scaling, right? How do we get past this point where we're kind of stuck and not moving to scale, not moving from single companies figuring out how to do this to entire industries at once? How do we anticipate and lay the foundations for use of data and sharing of data, not just by people and institutions, but by AIs, right? To deliver at scale data sharing through automation and AI solutions, right? How do we ensure protection of data privacy and human rights in the process? Can we support the full modality of access types and of business models? That is to say, supporting not just data shared openly, but also data that's so sensitive that it can't be accessed directly. Can we support everything from the open data movement and making that data available to business models, where what you're essentially doing is discovering and navigating a process whereby you're paying to transact, right? To transact, to purchase access to a set of data for a specific purpose. So, and finally, we've been very much inspired by what's been happening in the blockchain space and looking at how we can lay the foundations of a decentralized future after a paradigm shift in which it's really not about a handful of companies owning and controlling all of your data, but you having a say in what happens to the data that you produce while you use digital services. So just a few more points very quickly. You know, the Secretary General in his roadmap on digital cooperation has made it very clear that digital public goods are a priority and that we need to have, as part of this, a global data access framework of some sort to open up more of the data that's out there so that it can be used for public good. What we see today is that there are at least sort of a few fundamental principles that we need to observe. One, this framework needs to be a standardized collaboration and sharing protocol aimed at reducing the time spent on negotiation and ad hoc solutions. It should be open and allow broad and easy participation of data and analytics contributors, because there's a lot of capability out there and a lot of talent. How do we start getting people all over the world and companies to build analytics on top of this framework so that they can support it? And the framework needs to be built iteratively and practically to scale proven use cases and approaches rather than a theoretical top-down construct. So we see going into this a number of different components. There's the framework itself, which we can think of as a set of protocols for defining services for publication, for sharing, for auditing, for example. We see engagement of frontline users looking for solutions. We see data and technology infrastructure contributors playing a role, and of course, analytics contributors playing a role. And the idea, of course, is that in a sense, we want to build this from both the bottom up and the top down. We want to have a standards component along the lines of what you'd see with W3C, for example, working on advancing a set of standards iteratively over time. But the way we want to get this process off the ground is by actually building real solutions based on artificial intelligence technology that require access to data sets that have very high potential for utility, but haven't been shared consistently in its scale in the past. And to go ahead and identify locations around the world where we can pilot these types of approaches, but instead of ending up at the end of the process with, well, we did one pilot there and it was a lot of work and it was very specialized, saying actually, because it's based on this standard, if it makes sense now to scale that to 50 countries, it's very straightforward to do so. So that's the idea with the Global Data Access Framework. And we, you know, from the very beginning of the Global Data Access Framework discussions, we were looking at a number of different pilot case studies, one involving using data to track non-communicable diseases and understand their risk factors, another for looking at infectious disease, a very timely thing today, and how could mobility data from mobile phone networks and other networks combined with predictive analytics be used for predictive epidemiology. And finally, another that was looking at disaster resilience, right? And how we can understand how populations are affected by disasters and plan their recovery process. So that's kind of the overall view of this. And I think we're today very much looking for partners who are interested in joining this effort. We're incredibly excited about the possibility of developing a new standard. It's not a standard that would replace others, but it would be a layer that could be added on to existing systems that would help to create a kind of connective tissue to allow more of the world's data to flow. And very, very excited about continuing the conversation today and following up with anyone afterward who's interested. Thank you so much. Cyrus, back over to you.
Thanks, Robert, for this great overview. And excited to move forward with GDAF on you, with you on GDAF. Now we're going to give the floor to Ashley van Etteren. Ashley is with, she's been involved in the GDAF process from the beginning also. She's with McKinsey. She's an associate partner there at McKinsey, and she's going to talk about the resilience case study that Robert mentioned. Ashley, the floor is yours.
Terrific. Hi, everyone. Yeah, indeed, I want to build upon 2 points that Robert mentioned today in this discussion. The first is really on scaling and how we can have scalable impact on using data and AI for the SDGs to move from helping, in many cases, thousands or hundreds of thousands of people to helping millions. And the second part is around data access, particularly when the data already exists. And I think the example of disaster recovery or disaster resilience is a great one for that. I mean, first of all, natural disasters affect anywhere from 100 million to 300 million people per year globally every year. For instance, last year in 2009, 95 million people were affected, and that could be everything from displacement, it could be from devastation of local housing, crops, or even disruption of services. And so the opportunity for us to really have impact at scale here is quite large if we come up with a solution for this. The second point is that these exacerbations in climate-related disasters are only expected to get worse in time. Perhaps 3 to 4 times the amount of natural disasters will occur over the next 20 years. And that will be exacerbated by an increase in flooding, an increase in overall temperatures, increased likelihood of cyclones and hurricanes, and of extreme rainfall causing floods. So, you know, the burning platform is urgent, and it's going to get worse going forward. And indeed, actually today, many AI efforts are already underway. There's quite a few number of use cases in this domain. Things such as using Facebook data to actually develop understanding of populations and population flows where people are being displaced to. So that way you can better target your aid distribution is one example. Finding alternative routes and logistics when the current infrastructure is down or their places become a little bit more inaccessible. And of course, with COVID, there's been quite a lot of tracking, epidemiological efforts, supply and demand forecasting for hospital beds. So this is another big area for where it can be of help. And to what Robert said below, the data in this instance is largely exists to fuel these analytical engines, right? If you look at the bottom, you know, a lot of this data already exists, but the ones in blue are actually particularly sometimes very easy if you could access to leverage the data. Weather databases already exist, satellite imagery, mobile networks, social media data, vehicle registration or power outage data. All of these things exist in actually a very comprehensive, high quality form, which would enable the use of AI in these areas. And perhaps to bring this to life a little bit, how could it be used? Many of you may have known last year there was one of the largest cyclones to hit the African subcontinent, Cyclone Idai. It affected about 3 million people, 300,000 of those were children. And the challenge with this is in a recovery and resilience state, sometimes it can take 6 months or even a year for these children to get back into school. And one of the reasons for that is that to understand which schools are damaged so that you can ask for aid to rebuild them, so that you can prioritize temporary school aid like school tents. All of this actually requires manual support. So after the initial crisis period, it requires somebody to on the ground go and visit each one of the schools and understand the damage. And so we thought, could we not change this? And couldn't you have that understanding within minutes, actually? And indeed, there's, us, this was an effort that we did in Mozambique, but there's also been many others who have been looking at, can you accurately classify building damage following using satellite imagery, augmenting that with weather data and building construction data to understand which buildings are damaged the most severely so you can target aid. So let's imagine the future, right? The future is that an aid person on the ground will have a targeted list where they can instantly see where the damage is the highest, the likely amount of population of children that have been displaced and are without schooling, so that way they can prioritize and be more effective. But this example, this vision is actually quite far off. And I think we actually realized that even harder ourselves on the ground, because even though we were working with an NGO, and even though this NGO technically had access to satellite data, it took us over 6 months to even figure out how exactly to get access to the data. And of course, in that instance of time, you can no longer help in the current situation. You have to do something that's helping to prepare for the future. And the root cause is that, governments and NGOs have a challenge to effectively use all the data that already exists. And they have even more of a challenge to translate the data into actionable insights that will help them. And there's a few reasons for this. One, of course, is that the access to this high quality data is a very slow process, as I mentioned. There is a lack of clear understanding often what type of data exists and what is the process to acquire that data within organizations. Once you even have access to the data, the infrastructure to manage it and to know how to process it or to leverage that data is also missing. There's a lot of pre-processing of data that goes into it being even usable. And finally, the world is at a shortage of data science talent at the moment. And of course, oftentimes these governments and NGOs do not get the talent that they need or do not have the resources to invest in data science talent that can analyze all the available data. So what can we do to change this, right? And I think it's going to take 3 things to really change this. The one that's quite crucial, that Robert was talking about, was data access. And there's actually quite a lot of various points around data access that need to be addressed. One, and the most simple of it, some of the frameworks that he's mentioned, is just understanding what data exists, who has access to it, and where does it sit. We need to figure out, second, a data storage model. And this is probably one of the most trickiest ones. What Robert mentioned before, some can be made public, but a lot of data will not be able to be made public. So some sort of federated data access model needs to be created, and data stewards set up in different companies who can provide access to this data. The access management system needs to be, a process redesign needs to be taken to that to make pre-approval easier, to make standards and common things like legal frameworks put in place ahead of time so it's clear how to access it. And not to be forgotten is the data pre-processing. So we need more common data dictionaries. We need more support from the data owners to actually make some of this data processed in a way that many organizations can instantly use it, as opposed to having to go through a processing exercise every time. And I mentioned the legal processes. So there's quite a lot that needs to be unpacked within the data access point. Briefly, I'll also talk about the other 2 points, which is that, you know, tools and analyses need to be developed, and that is helping these organizations with pre-developed analytical models and AI models and APIs, so that way they can leverage these insights, and also making sure the infrastructure is there, particularly with cloud computing capabilities. And finally, I think you know, an often underlooked point is the amount of expert support that's needed for these governments and NGOs. So you know, this is everything from, could we not have a crisis recovery team, so standing teams that were deployed from technology companies to help support in crises. Many organizations are already doing this. I know Facebook and Google have sort of standing crisis teams that help support in these areas, but more effort, particularly from the private sector, to help support in these efforts is needed. So what needs to happen? You know, to create this, it's going to take a collaboration. It's going to take a coalition of partners coming together to really unlock this. And that's everything from the frontline aid organizations. What do we need from them? They need to be able, and I know it's very challenging, but they need to be able to dedicate some amount of resources, because data access and insights from data, algorithms are living things. And so, you know, there needs to be support in the frontline organizations to actually be able to translate these insights into actions. And I think one thing that has been very positive is that many organizations, from UNICEF, from the Red Cross, and many others, are already piloting initiatives, but they need to commit to scale. And that means changing their operating model and processes a bit more. Technology companies, I think a lot of technology companies, Microsoft and IBM, Google, ourselves, ARM, have committed talent to this problem. So I think there's not a dearth of talent that can be mobilized against this. But we also need to commit to putting that talent, not just to developing the solutions, but actually building the capabilities of these frontline organizations so we can create sustainability. In fact, the data owners, you know, we have to find incentives to share the data in many of these situations, and to make it feasible when data is also, you know, a valuable asset right now. And, you know, there will need to be more support as well on the pre-processing and the stewardship, which can require resources from the data owners. And finally, from the funders and philanthropists, you know, many have yet actually to really turn towards technology to unlock some of the solutions of the SDGs, and you know, commitment to investing in scalable solutions and self-propelling solutions where you can create sustainability even in for-profit solutions would be warranted in this field. So with that, I hope I've left you with some tidbits and some thoughts to chew on before we go to the next speaker. Thank you, Cyrus.
Thank you very much, Ashley. Looking forward to the discussion. So I'm giving the floor now to Anne Akiteng. So Anne is the Deputy Director of the Uganda Initiative for Integrated Management of Non-Communicable Disease. Anne, the floor is yours. And you have to unmute yourself, Anne. No, still not. Yes.
So thank you very much, the organizers. I'm very excited to be part of this forum and for such a discussion that I believe, for me as a young scientist from a low and middle income setting, it's such timely and, you know, in the face of all that's happening globally. I'm happy to be part of the discussion talking about digital data. As a scientist, as a medical doctor, as a researcher, a consumer, a parent, I relate with situations and issues, challenges that surround data, access to data, quality data. accessing quality data in a timely manner, maybe in a way that is appropriate for a specific purpose. So I'm happy that there is a discussion on this going on. So in low and middle income countries, I'm happy we are represented on this forum. We have a unique landscape, varying levels of use and skills related to digital, technology and so forth. But we also have a unique set of challenges. When you speak about Uganda specifically, when it comes to digital data, I know we have some varying levels of use, but I could say generally that we've either been sleeping or we've been dragging our feet. And COVID-19 only came, to tap us and give us a wake-up call to take this issue more seriously, but also that's if there's already been some work going on with digital data, so you improve the pace, but if you've not actually thought about it in your sector, to think of how to incorporate digital data. But importantly, I think it's good for us as a nation, as a country, or as a continent to start to look at digital data as a good case for economic investment and not just another expenditure. So digital health, digital data, is not new in Uganda. We have used it for quite a while in the financial sector, education sector. We have road sector, health sector, but as I mentioned before, there are varying levels of use. And of course, for some cases, it's actually a mix of digital and paper-based. So there is really no motivation to make sure that the digital is well organized, is accessible, and has reliable information, because people are used to the traditional paper-based data, and they know that it can always be a very good fallback position. So for example, in road injuries, we've done some work with the police and in trying to improve their data, road crash data, because we've had a paper-based system which we use to generate data that informs global reports. But you can imagine a paper-based system if a victim is crashed in maybe a road in the countryside and the information only reaches the center maybe weeks later, and sometimes it's lost. So it's good to see that there are sectors that have used it traditionally. There are those that are starting to embrace. So we are actually working with them to digitize the road crash data. I've also learned that in the agriculture sector, for example, there are initiatives that are trying to connect different, the farmers, buyers, suppliers, and the market. So it's good to see that people are waking up to embrace technology and the digital data and all the advantages it comes with. So I'll speak a little bit more about the health data, the health sector, which I'm part of, which I'm familiar with. So we've had different systems before. There's the DHIS2, that is the District Health Information Systems, that has been helping the country to collect data from different facilities, and they push it to the Ministry of Health headquarters, which is like the center, and they make all these summaries and statistics. We've had, of course, it has its own challenges, but at least it's been available for a number of years now, and it's continually being improved. We have so we have the electronic medical record system that has been piloted in a few facilities, but the government is actually planning to roll it out nationally, but they want to do it in a cascaded manner or in a phased manner, starting with the higher level health facilities. And this one involves capturing all patient medical records from the facility. We also have RX solution. It's, I think, still in development, but it's being used to support the taking stock or management of stock and medicine supplies in different health facilities, so that people are able to plan appropriately, order what they need, but at the same time, maybe forecast demand for the supplies that they may need for a facility. Of course, our setting has a lot of issues around supply chain management. Then we also have different initiatives and applications for community-based digital platforms. We have the Family Connect at the Ministry of Health. We have the Safe Pearl, which is an app for like adolescent health. So there are different initiatives and many more that I may not be aware of, but I'll talk more about the community-based platform where my organization comes in directly. So it's Family Connect. It's supported by the supported by UNICEF, but it's based at the Ministry of Health. And the main agenda behind it is that if you improve access to quality information in a timely but also consistent manner, it will motivate the consumers to change behavior, and of course, being a health initiative, to improve uptake of health services and subsequently improve outcomes. So they tried it out on pregnant mothers, and they used to connect with the village health teams to register them. I will not go into the details, but what is important to say is that it was good because there is good reach in terms of funds, access to the health worker registration, connecting the pregnant mothers to the health facilities. They were able to improve antenatal attendance, deliveries in health facility, and I think they also noted a reduction in maternal mortality in some of the districts where this was piloted. And so they've rolled it out gradually. I think they are covering maybe about a third now of the country, but they've also extended it to include things like nutrition, of course, monitoring the danger signs during pregnancy, postnatal period. In early childhood, they are looking at things like immunization, growth monitoring, yes, for the children. So my organization, the Uganda Initiative for Integrated Management of NCDs, is privileged to have introduced the non-communicable diseases module onto this platform. So everyone is excited, the Ministry of Health is excited, UNICEF is excited, because we have a rising burden of NCDs in my country. We are still grappling with maternal child health issues, infectious diseases, road traffic injuries. And so we felt it would be nice to tap into a platform that is going to leverage, access issues that and services that have already shown to be fruitful to the community. So in our NCD module, the main framework is based on the self-care agenda. When you're looking after patients with chronic diseases, most non-communicable diseases are chronic, like diabetes, hypertension, and so forth. There is long-term care, and in our countries where health systems have, so many limitations, we thought empowering patients through self-care would be very good, first to decongest the health system, but also it will maybe improve their well-being, while at the same time reducing the need to frequent the health facility if you have complications, but also helping them cut the out-of-pocket costs in terms of transport and going back and forth the health facility. So far, this is going well. We are excited because we know that we have to address the issue of NCDs now. So we've started with heart failure because we want to pilot it in a specific setting in a health facility. Look at the outcomes, look at the reduction in patient visits. We also want to actually see how effective this is to both the patients and the providers. The pilot indicated that the patients are already excited, the clinicians are also excited about it. And we have a high penetration of phones in our country. So the system we are using uses a simple, it's called a USSD code that you can use on both the analog phone and a smartphone. And in our country, most of the mobile transactions or financial transactions now outside of the bank used by mobile money or mobile money. So you use just a PIN to dial and then you access the health workers. So we found that it's something that is going to increase reach even to those who may not be able to access the smartphones and those who may not be able to, type messages. So when you look at the challenges, we have, of course, a number of challenges. The ones they've already mentioned at a global level, but also at a country level. We are still grappling with issues of, infrastructure. If you're looking at a health
think we lost Anne. Anne, can you hear us? Maybe we're going to move to the next presentation, and you can conclude your presentation in the discussion after. So I'm going to give the floor to Dr. Tayyab Wasim, who is the Chief Scientist Officer of KAYAK, which stands for Collective and Augmented Intelligence Against COVID-19. Tayyab, sorry, it's early in the morning here. The floor is yours, and we're going to get back to you after. Or unless you want to conclude
Okay.
now.
Oh, I think she's back. We'll let her finish up.
Yeah.
Absolutely.
Yeah. So we have issues around infrastructure, staffing, connectivity. If you need internet, and you can already see even me who is in a capital city, I mean, in a global conference, and actually having issues with internet. So how much more for someone country? For health facilities, we also see some resistance to change. There are people who are already used to their paper-based records, and so having to do the double work of entering to a system. There are skills issues. We have also issues around weak regulatory framework. So I'm happy that this forum is addressing such issues. We have issues around coordination, monitoring, mini-fuel, and also linkage of data. If, for example, I'm able to record digital data at a crash site, how am I able to know that it's the same patient that has ended up in facility X and has ended up in the mortuary, and it's the data reported to the health facility, to the national database as 3 accident victims? We can't really know. So there are such issues. We also have quality issues, especially where at the point of entry, the data is not automated. We can't really fully rely on it. We have issues of ownership. There are legalities around there. Who owns the data? Who owns the saver? Then, of course, there are issues about, of course, we talked about privacy. How do you ensure privacy and patient protection? Sometimes bureaucracy. As a researcher, you want to access data. There might be a digital database somewhere, but then there is bureaucracy trying to negotiate. People are kind of like, what is it really? What do you want? What is this information? So maybe because they are not really confident of how you will treat the data, sometimes there are bureaucratic barriers, and it will increase time of access. Yes. So I must say that overall, I'm happy to be part of this, and I'm excited that we have a platform like the Global Digital Access Framework that is already having a dedicated team to look at such barriers, and already starting to think of legal frameworks and support systems for countries, but also having the connectivity that if I spoke to you today, I can learn a lesson from a different country. And so in a way, of course, COVID-19 has really highlighted the gap for us, but I'm glad that there's a platform like this that is already starting to have those discussions. And so we are happy to be part of it, to learn, but also be able to contribute to the evidence base that is in this forum. Thank you very much.
Thank you so much, Anne, and really looking forward to discussing with you on GDAF and having your voice there. Extremely relevant example you have on the field. So Tayyab, I'm going to give you back the floor, and you can start your presentation. I believe it's going to be on infectious disease.
Yes, thank you, Cyrus. All right. Yeah, originally I had this set up to be for non-communicable diseases, but Anne did such a great job kind of touching on all of the various aspects of not only data access, but regulation that really provide barriers for both non-communicable and communicable diseases. So throughout my presentation, I'm actually going to try to tie as much of this back into infectious diseases, but I think the principles that you can take from one really apply across the board. So though my focus today will be mainly on SDG number 3, as I go through this presentation, I ask everyone to take into account how the principles being used for this SDG can be readily applied to many, if not all of the others. So for those unfamiliar with the terminology, non-communicable diseases refers to diseases that are not transmitted from person to person. As we can see in the WHO graphic on the left, non-communicable diseases account for approximately 70% of deaths worldwide, a majority of those premature deaths, unfortunately, occur in low and middle income countries and largely can be prevented. I personally believe with the correct framework and incentives, we can well surpass the goal that the WHO and UNDP has set. So to really hone in on not only how we're going to achieve these goals, but also the types of data structures needed, I think it's worth taking a quick look at the risk factors underlying the development of many of these non-communicable diseases. As we can see, there are a combination of factors, including genetic, physiologic, environmental, behavioral, and others at play. And though these diseases may be non-communicable in the traditional sense, one could argue that they spread through social networks, the built environment, social and economic conditions, and that they actually have intergenerational transmission. In a more traditional sense, you also see very heavy overlap in the risk factors for communicable diseases such as poor water, poor hygiene, crowded conditions, lack of shelter, inadequate access to healthcare, and forced displacement. Additionally, I believe it's very easy to see how many of these underlying drivers for both communicable and non-communicable diseases, such as globalization, urbanization, and the social determinants of health, are intricately related to the other 16 SDGs as well. I think there's no surprise on this slide as to why we need accurate and up-to-date data. Next in this presentation, I'm going to go over a bit more of the technical challenges faced in the computational epidemiology world and how creating a global data access framework can help overcome them. I think Ashley brought up a lack of talent in her presentation in terms of having enough data scientists. And while I do believe that it is important to train more data scientists, if you ask any data scientist how they spend a majority of their day, unfortunately, the answer often revolves around cleaning data. To use data from multiple sources, it needs to be merged seamlessly, integrated in, and have the same definitions. This unfortunately falls apart as you bring data from various organizations into play. I put one simple example here on the right of different formats one piece of data can take, and this is before we even bring language and translation and other complicated inputs into play. So most modern day disease surveillance systems rely on a very complex hierarchical reporting system. Raw data is captured at an individual level and then anonymized and aggregated. This data is then sent to the next level where often details and valuable elements are lost in order to combine with other data sets. Unfortunately, there's often red tape between many, if not all of these steps. A gripe that I often hear from epidemiologists during the current pandemic is that one county has data accessed with their own rules, whereas others don't. And that by the time you get access granted to one data set, the others are already out of date. So in keeping data sets current, we all know speed is the name of the game during infectious disease outbreaks. As we're seeing with COVID-19, public health officials and other relevant stakeholders often can't just idly wait around while current work streams ineffectively put out data. Slightly different from non-communicable diseases during a pandemic, the rate at which new knowledge is being generated is overwhelming. Projects like the Core-19 dataset from Allen AI allow us to leverage data science in keeping up to date on the rapidly changing literature that comes out for the pandemic. As we are seeing the current pandemic play out, we see that an effective response does not only involve healthcare, but requires us to take into account other knowledge domains such as economics and social factors. Even within a specific data domain, projects are often siloed. While doing an initial mapping for our 3 first use cases for Kayak, we identified over 300 distinct contact tracing apps, 1,200 targeted aid policies, and 100 different country policies for tackling the infodemic. Before putting together Kayak, there was no central system to see who's doing what where, what works, what doesn't work, and how we can actually have people working together to move towards a common good. I believe if we take the principles that we learned while developing Kayak and put them towards creating GDAF, we can start bridging a lot of these silos and make it so that we can all work together more efficiently. Now, COVID-19 resulted in a boom in the use of digital technologies and brought to the forefront legitimate public concerns regarding privacy, data protection, and civil liberties. Having regulatory frameworks established ahead of time would allow the successes we saw, such as evaluating the effectiveness of non-pharmaceutical interventions at a granular level or supporting telehealth, be more quickly and widely adopted. saving time, resources, and most importantly, lives. Now, I wanted to take a couple minutes to highlight one or two projects that I saw come together during the pandemic that I believe we can all learn from. The ACIP is a project our friends at Data for SDG introduced me to, and I snagged this slide from a presentation posted online that shows how different sectors can come together to create a cohesive platform to make a change. The platform ingests multiple data types at various levels, breaks down many of the barriers I spoke of earlier, such as regulatory compliances and privacy, and brings together most, if not all, relevant stakeholders. Another set of projects I saw created digital twin cities at a very high level of detail to model out how different policy decisions would impact the spread of disease. I saw amazing models that used passively collected, aggregated, and anonymized geolocation data that can inform us and model spatial and temporal dynamics of infectious diseases, bringing in variables such as gyration, dwell estimations, and contact matrices. As we become more digitally connected, we can create even richer data sets that allow us to better predict and model complex systems. For that reason, I believe that when creating the Global Data Access Framework, we should keep it open to the possibilities of new data types that we never expected to use. Now, imagine taking many of the best practices we have seen come out of the digital transformation from COVID to other facets of healthcare. We've been hearing the term personalized medicine for years now, but the implementation has struggled partially due to the inability to generate a high enough power to develop statistical significance. We have lots of omics now, whether it's genomics, proteomics, metabolomics, transcriptomics. Really, you could put an omics at the end of it and it probably exists now. We're generating a ton of data that doesn't really live up to its potential. The pandemic has forced us to find ways to anonymize and protect data while preserving all the multivariate statistical properties. Imagine the insights and advancements we can make with rich data sets like that. And really to end, I just want to drive home a couple things. I hope through this presentation, I've shown how a global data access framework would allow for global data to be easily collected without the challenges we currently face. This would in turn streamline epidemiological and public health analysis, modeling, and informatics, resulting in better public health decision-making capabilities for everyone. I firmly believe that creating frameworks like GDAF will allow us to interlink the various SDGs and move towards a better tomorrow. Thank you.
Thank you very much. I give the floor now to Dr. Dustin Gibson. So Dustin is an assistant scientist at Johns Hopkins Bloomberg School of Public Health. Dustin, the floor is yours. And we cannot hear you.
There we go. Sorry about that.
Fantastic.
And sorry about my lighting situation. We're in the process of moving houses and a lot of the lamps have been packed up already. And I thought it would be a little bit lighter by now, but it's early in the morning here on the East Coast. So thank you everyone for virtually joining today. I am an assistant scientist and working on the Bloomberg Philanthropies Data for Health project. Slides. Since 2015, the Bloomberg Philanthropies Data for Health initiative has enrolled over 20 countries with its goal, as its name implies, to improve the use of data for health. There are 3 arms in this initiative. The first arm is to improve the civil registration and vital statistics, and that's work being led by CDC and the University of Melbourne. The third arm is the data impact or data use arm, and that's providing guidance and TA to countries and governments on how to use their currently collected data in the hopes of enacting policy change. And the second arm, which I'll focus on today, is a partnership between Johns Hopkins University, CDC, and the World Health Organization, and it focuses on using mobile phone surveys to conduct nationally representative estimates for non-communicable disease risk factors. I know Tayav just went into a little of this, but here we're really focusing on the 4 major modifiable behavior risk factors for NCDs: tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. Together, these contribute to about 50% of all global deaths. The good news, however, is that these risk factors are all modifiable, and if we can implement public health interventions and monitor their trends, we can help to begin to reduce the NCD epidemic. If we think surveillance of NCDs and their risk factors is one way to curb this epidemic, then we have a real opportunity. As we know, household surveys are the traditional gold standard for collecting population health estimates. However, their high cost and time, the time needed to plan, implement, train staff, and analyze prevent them from being conducted frequently. If we look at household surveys like STEPS or the DHS surveys, we see these are conducted every 5 to 7 years, where in some cases we're working with really very old data, and we need more frequent representative data to inform and evaluate policies. In the US and other high-income countries, to avoid the high cost of household surveys and allow for more frequent population monitoring, we can conduct telephone surveys. Telephone surveys are not that radical. In fact, CDC has been conducting these types of surveys since the 1960s. Although telephone surveys in high-income countries are not that radical, their use in low and middle-income countries is a little bit radical right now. This is a time series map just showing mobile phone subscribers per capita per country over time, and you can see that Sub-Saharan Africa, Southeast Asia, there's more and more access to mobile phones, allowing for the potential to perhaps reach these individuals. So in our initiative, we are looking at delivering mobile phone surveys across these 3 modalities. SMS surveys, which I think we all know what they are, computer-assisted telephone interview, which is essentially we set up call centers and a participant, we call up people and they speak to a human over the phone. And then we have IVR surveys, which are interactive voice response, and that's pre-recorded audio where the participant then presses a number on their phone. So for example, in the US, when you call up your bank, it might say press 1 if you'd like to speak in English, press 2 if you'd like to speak in Spanish. So Johns Hopkins' role within this initiative is to really inform the research and development of CDC's work, and specifically it's to assess the feasibility, quality, and validity of using mobile phone surveys for NCD surveillance. And we do this through a series of rapid micro trials or very quick randomized control trials where we seek to evaluate different mechanisms to improve the performance of these surveys, the response rates, completion rates, etc., and to look at the relative advantages and disadvantages of each of these modalities. And we also have an ethicist on our team that's looking at some of these key ethical, legal, and societal issues, as this is a rather emerging field. So to date, we've, in the past several years, our team has been quite busy. We've collected over 30,000 mobile phone surveys with academic and government partners from Columbia, Javierna University, Makerere University School of Public Health in Uganda, Ifakara Health Institute in Tanzania, and the Institute of Epidemiology, Disease Control and Research in Bangladesh. And in terms of CDC and WHO roles and responsibilities, we're really seeking to validate these findings. So CDC is supporting countries to roll out age-sex national mobile phone surveys, via IVR, SMS, etc., while simultaneously WHO is supporting countries to conduct the traditional STEPS household survey for NCD risk factors. So we're then able to compare these same questions over 2 different sampling frames and 2 different modes to see how well these estimates approximate each other. So since the project has started, CDC and WHO have completed national household surveys and mobile phone surveys in Ecuador, Malawi, Morocco, and Zambia. And I think the main finding is that the estimates the prevalence of tobacco smoking, the prevalence of harmful alcohol use are similar for most of the age groups, except for the older women. There's a little bit, and it's a known phenomenon of the digital divide where older women have less access to a mobile phone. So in some of these lower income countries, such as Bangladesh, we're having more difficulty reaching those older aged women. But I think there's a real, as our teams at Hopkins, CDC, and WHO continue to validate the mobile phone survey methodology, there is a great potential for its use for NCD surveys, but also for other behaviors. I know CDC has been recently sending out COVID-19 surveys as because with this methodology, we're able to quickly collect data. This is just one example of the speed with which we're able to collect data. The x-axis is the number of days running, and on the y-axis, the number of complete surveys. And in Uganda, where we really took the throttle off the platform and let it run full speed, we were able to collect 14,000 surveys of 35 questions within four working days. So comparing the progress or the speed of this to a household survey is really not at match. I think the other big advantage of these types of surveys is they're relatively inexpensive, with costs ranging from $2.50 to $4 per complete survey, and that main cost being the driver of that cost just being the airtime spent to send out the surveys. So why particularly is this significant? I think our research, and the validation with CDC and WHO will help health agencies, governments, and academics use these types of surveys for not only NCDs, but other public health data. This is a very emerging field, and we're hoping to document this with best practices. And I think the sort of take home is if we can successfully validate this methodology, I don't think we'll ever be able to replace traditional face-to-face surveys, but this will serve as a way to complement surveys, save cost, and more frequently monitor the population. Just for your reference, we put together a theme issue with 8 manuscripts that range from some of our protocol sampling work to policy implications. And to wrap it up, we have a website that has some of our fact sheets and publications and about our team. So I hope I left us enough time to have a discussion as the last speaker, but thank you very much.
Thank you for a great presentation, Dustin, and looking forward also to having questions there. So regarding questions, we opening the floor for questions. So I believe you have a couple of platforms where you can ask your questions. Please do so. We're going to collect them and ask them as we move forward. I'm going to start asking the first question to Robert. Going back to the Global Data Access Framework, so what are the next steps with regard to the implementation of it and the pilot countries?
Sure. Yeah, so I mean, we're in general very much looking at how we can get more partners on board for this, and we see a number of areas where we think there's potential to start moving forward. So certainly in terms of what we want to do going forward, one is that we have an initiative. We have initiatives already underway in both Ghana and Uganda on that are sort of looking at these two branches of work, two work streams simultaneously. One is development of ethical AI governance frameworks, and the second is development of a data market strategy and starting to do prototyping around data markets. So we think this is a great opportunity to really look at kind of how you could create that type of infrastructure particularly for some of the industries that we've heard described today, right? If you look at mobile, for example, if we look at retail or e-commerce, financial sector, how can we, in support of some of this work on infectious disease modeling, on NCD risk modeling and behavioral analysis, as well as work in disaster resilience, look at whether we can develop data markets based on this emerging GDAF architecture, because again, that having that standardized approach would make it, if we end up with a specific solution built on top of that data market, in a way that everybody says, why aren't we doing that in 50 countries? We would actually have a much easier time moving to scale. So we're going to be looking at, at it potentially in those countries, infectious disease and non-communicable disease work, and also starting to look for, not only in those countries, but elsewhere, for opportunities to look at disaster resilience, and particularly around the area of disaster recovery. As we heard earlier, we think flooding is particularly an interesting type of disaster because its secondary impact spans so many different thematic areas, so many different SDGs.
And so many different type of data, satellite data and telco
Exactly.
and more. Yes, absolutely. Ashley, question for you. You mentioned a few elements the global community would need to address to unlock data and AI to address disaster. How close are we to these?
Yeah, I think there's two dimensions of that, right? One dimension was in terms of the data access, the expertise, and the AI solutions. And the other access was, in terms of how stakeholders are working together to kind of unlock this. I think on the, on the first three, where the world has gone, while we think of AI, actually the challenge of AI is not the algorithms themselves. So there have been, if I can think about the building damage prediction tools, there's been at least 10, 20 plus different, at a minimum, different algorithms around the world or organizations working on that problem. So it's not the AI algorithms that need development. And to Tayyab's point around the data science, a lot of them already exist. For me, the two biggest elements on that point are really the access to the data access to more people. To Robert's point, there already are some accessibility points. So if you talk to a UNICEF, or if you talk about satellite data, there is a UN agency that is a UNISAT, which has made satellite data available, but the process to access this for the average organization is still quite complex. So I think that's definitely one area, and this concept of really building capabilities is another area. So I think, those are the two, if I think about the first for the first access. And then if I think about the second, which is how are the stakeholders coming together, the technology companies are there and they're providing lots of resources. So I think we really need to focus on, one, helping the frontline organizations get to a point where they can scale and really commit to supporting this, and for that they need funding, right? So I think they need to really move from a let's pilot something to yes, if I'm thinking about an NGO, how do you go from I will pilot this in one flooding instance to I will be prepared in all the countries where I operate to rethink how I help support in flooding with data and AI, right? So that's a big step we need to make. And on the data owners, we really need to get people together. Some of the data, which is the most simplistic, should be to access, for instance, telecom data or mobile phone data in order to track in cluster base, so anonymously, flows of people. This is very simple, but still very hard to access. So we really need to support on there. So net, I think there's a lot to build upon, but there's really just a few of these unlocks we need to work at to really make a significant progress.
Thanks, Ashley. I just received a note that we have to close at 15. I thought we had a little bit more time. So I'm gonna have a question for every one of you there. Question from Suman Aparusis, who's a member of Board of Trustees at Change Plan Partners, Climate Innovation Foundation. So with data for surveillance of NDC risk factor on the rise, we noticed that data privacy concerns are at an all-time high. Is there any specific challenges that are applied to address the concerns in the context of these very amenable use cases? Who wants to take this question first?
I'll dive in since I made the mistake of unmuting myself first. But I think Robert actually did a really great job in the beginning, touching on it. I think it's true we have very legitimate concerns regarding privacy, data protection, civil liberties, and being able to aggregate it. But at the same time, this pandemic has shown us that we can do it. We have seen people anonymize and aggregate data and still preserve all those multivariate statistical properties that you see each individual have. You've seen for the first time all these major corporations come together and make new assets using privacy data. And I realize a lot of companies don't want to give up data because often it's considered a commercial asset. But if you can frame it and provide the right incentives, I think you can move towards that greater good.
Yeah,
anyone else want to take it on privacy?
Cyrus, yeah, I'll just jump in very quickly. I mean, I think, 5 years ago, the answer would have been different, but we're now in a space where we've seen advances in terms of the math, frankly, that make it possible for this not to be a zero-sum game, right? There are technologies out there. And I mean, if you talk about, all of the well-justified concern about, contact tracing systems in COVID-19 being rolled out willy-nilly without much in the way of transparency and regulatory frameworks, and certainly no certainty they wouldn't be repurposed in other ways later. There are existing examples like SafeTrace, which are using privacy protecting computation to run contact tracing, right? So it feels almost like cheating if you're sort of thinking about the way things used to be. But the fact is, we can use these systems to answer questions about data that is never accessed directly by a human being. And that's pretty exciting. So I think the key here is to invest in these kinds of approaches and demonstrate the utility that's possible without sacrificing privacy, so that we begin to think in a sort of more holistic way about how to tackle these problems and not assume, well, first of all, we'll never be able to do that because privacy would be sacrificed. It doesn't necessarily have to be. It has to be protected, though. There's no question there.
I think we have 2 more minutes. If you want to, somebody has some concluding thoughts to wrap it up. Maybe 1 minute each to give your thoughts. Anne, do you want to start? Anne, you have to unmute yourself.
Yes. So thank you very much for this opportunity.
Go ahead, please.
So just wanted to say thank you for this opportunity. It's been nice to hear all the different work that's going on. And as someone interested in that field, there's definitely lots of potential and room for opportunity to work together and collaborate. I think the COVID pandemic has only highlighted the gaps, but also opened our eyes to the possibilities that are out there. So I think we should just embrace them and see how we'll flow with the tide. Thank you.
Yeah, embrace the good part of the accelerated digitalization, for sure. So Dustin, you have the final word for the final minute.
No, just thank you very much for joining. And I think, it was great to really learn about the GDAF, and, I think maybe there could be some collaboration within the Bloomberg Philanthropies Initiative, since we're, working with it's not passive data, but we're trying to improve the birth counts and death counts. And last I checked, there were a few billion people in the world. So I think, it's nice to have these frameworks and standards laid out. So I really enjoyed participating today.
Thanks a lot, Dustin. And to that point, and to Robert's point, all the participants here can contact UN Global Pulse. This is very much a collaborative exercise, global collaborative exercise, and I encourage you to bring your voice to this conversation. So thank you very much, everyone. We're going to wrap it up now, and yeah, looking forward to bring this conversation into real life and having a solution that can actually make an impact. Thank you very much.
Thank you, Cyrus. Thank you, everyone.
Thank you, Cyrus. Take care.
Thanks, Cyrus.
Thank you.